I am an RN, and I now work at Meridian Park Hospital. But a few years ago when I was working at a different hospital, I had an incidence of taking care of a patient I was not qualified to care for. The OB department was overcrowded, so they sent us a postpartum mother who was had severe pregnancy-induced hypertension. Her baby had been transported to Portland for more acute care, and she came to our ICU. She was on an IV magnesium drip, which made me extremely uncomfortable. I knew she was a critical patient, but not in a way that I could necessarily take care of her. It wasn't until about halfway through my shift that my brain remembered back from nursing school that I should be doing deep tendon reflexes and probably some other assessments specifically for patients on magnesium drips. She really deserved a well-trained OB nurse, but instead she got me. I hadn't felt for a uterine fundus since nursing school. I didn't know how to help her pump her breast milk. I didn't know how much bleeding necessarily was normal, how often to check for bleeding. Luckily, she and I made it through the shift safely, but it was quite an emotional roller coaster for me going throughout the day and realizing the things that could have gone wrong. You know, she deserved a nurse with experience, not one constantly consulting a mother-baby nursing book. I was as qualified to care for her as an OB nurse was qualified to care for somebody having an acute MI, which I just wasn't. So I really think this legislation is important to ensure that patients get the proper nurses and nursing care that they deserve.